We welcome you back to the Michael Garfield Show. How are you on this wonderful Wednesday, right about 12:50 in the afternoon? And you know what we do every Wednesday at 12:50? We take a moment or two to talk to one of the wonderful doctors that we have here and around our listening audience. Thanks to Altus, it's the Altus Healthcare Minute. Actually, it's several minutes throughout this interview. Now, this week, again, another compelling doctor. I always feel I feel a little dumb, a little stupid. I'm always having these doctors. I play one on the radio, but we got another wonderful one. Is Dr. Jeremy Wang, neurosurgery, spine care, based. He's got a few offices down south. Dr. Wang, appreciate you taking a few minutes to join me. How are you?
Great. Thanks for having me here, Michael. It's a pleasure to be here.
Tell you what, very impressive education. Undergrad, Stanford, medical school, New York University. What are you doing in Texas, brother? Come on.
I needed some warmer weather.
And maybe no state income tax, too.
That's right. Doesn't hurt.
That'll help also. Well, listen, you are a board certified with the American Board of Neurological Surgery. You're a fellow of the American Association of Neurological Surgeons.
Yes.
Tell me about the types of patients that you see in your practice.
Sure. Broadly speaking, we deal with surgical problems that affect the brain, the spine, and the peripheral nerves. Most commonly, what I see are patients with problems related to disc herniations or stenosis, which means narrowing due to bone spur formation from arthritis around the nerves or the spinal cord. So the majority of what I see is spine surgery, but I do also deal with a carpal tunnel and even some brain tumors and stuff like that.
I guess, okay, so in English and plain terms for me, do you see is it a specific age group? Do you see disorders with spine, carpal tunnel, with teens, with kids, with people who are up in age, or pretty much across the board?
Good question. Mainly adults, so age 17 and older. So I don't see pediatric patients, but adults.
There have been a ton of advances in spine care and surgery lately. Spine surgery, from what I remember reading and seeing reports on, it used to be a really, really major procedure. But now we have things like minimally invasive spine surgery and artificial disc replacement. Tell us about these.
Sure. That's a great point. Part of the change has been in the thought process. People that had spine surgeries used to be kept in bed for weeks at a time. And over time, that would just cause people to have blood clots, bed sores, and so part of what we do now is we try to get people back to activity as soon as possible, and that's what helps makes some of the surgery less invasive, but also there are retractors that allow us to do things less invasively through smaller incisions. There are ways we try to preserve the motion at a joint rather than fusing it, and even for fixing fractures from osteoporosis, we have ways to do it now through needles, whereas before there really weren't any good surgical options. So there's always advances we try to do to make things easier for the patient to fix the problem less invasively.
Needles, how big needles, man?
Really not that big, they're asleep when we do it, so they don't feel it.
Because I'm thinking maybe I would do surgery versus needle. I'm not a needle guy, but but I assume the recovery time is much faster too with these advancements.
Exactly. Many of the surgeries we do or I do for both the neck and the low back, people actually go home the same day because, again, we want to get them up and active and walking again rather than laying in bed. So, we try to minimize their hospital stay as short as we can.
Dr. Jeremy Wang joining me here for a few minutes. It's the Altus Medical Update every Wednesday, advances in neurosurgery and spine care. Doctor, so many people suffer from peripheral nerve disorders. Can you tell us about those and some of the treatments that you provide?
Sure. Probably two of the most common are carpal tunnel syndrome, which is when the median nerve in the hand and wrist area is compressed, and there's another related phenomenon called cubital tunnel, which is when the ulnar nerve in the elbow gets compressed near the funny bone area. But basically, there's multiple potential causes, but the direct reason for the symptoms are due to compression of the nerves. So we try to restrict motion in those joints to see if that helps with braces and slings and stuff like that, and maybe some physical therapy. Occasionally, injections can help, but in the end, if the symptoms continue to worsen and the patients start to suffer neurologic problems with weakness, numbness, or tingling, then at that point we would do decompressive surgery to release the nerve so that it can be freed from compression and start the recovery process.
Talk to me about your offices. I know you have one in Clear Lake. You see patients from all over Houston, if not Southeast Texas. Is that right?
Yeah, actually, that's a great point. We see patients actually from all over Houston, but my main office is based in Clear Lake, and we serve the community down there. And I also have another office in Baytown to serve the community out east. But we're happy to help people from anywhere. So.
Gotcha. How about real quickly a phone number and a website? People want more information.
Perfect. The office phone number is 281-333-1300, and the website is just my full name with MD at the end, so JeremyWangMD.com.
JeremyWangMD.com, 281-333-1300. No doubt we're also going to put this on my blog as we do all the doctors each Wednesday for the Altus Healthcare Update. Dr. Wang, appreciate your the opportunity to learn more about what you do. Congrats on the success you have over here. And if anybody needs help, everything you talked about, you know where to find it. Start at the 950.com. All right, I will let you go back to surgery right now. Very busy man.
Thanks for having me. I enjoyed it.